Medical advancements are changing the way many of us experience health care. In this week's Medical Center Health Systems Taking Care of You, we're taking you into the operating room with a group of local students to see how robots are changing the future of medicine.
If you go left, it'll go left. If you go right, it'll go right. Robotic surgery is gaining popularity. The reason for that is education of the patients, that they actually demand surgeons to do robotic surgery for them. Less pain after surgery, faster recovery. From my own patients, that I had a patient who I did a single-site gallbladder with the robot, with the Da Vinci. 2 weeks ago, he came to my office last week and he didn't even take any pain medications whatsoever. The Da Vinci system allows us to do intricate surgery with small incisions.
In my robotics class, what we do is my kids are given challenges and they have to build or design the robot. Then they have to program the software so that they are able to complete the challenge that was set for them.
Whatever your wrist can do, these instruments can do that. They mimic, basically.
I just wanted them to have a feel for what is happening in the robotic industry, and just so that they would know how robots are being used in real life.
We learned how to program and just build basic robots.
How different is this robot so far from the stuff you've worked with?
Extremely different. I have no idea what's going on.
And I just wanted my kids to have the opportunity to see the robot, and so I got together with Medical Center and they were more than willing to give that opportunity to my kids. I just kind of want my kids to have the same opportunity that the big schools have. I want to give them as much an advantage as a big school, because we are a small school.
We build our own robots and we get to program them the way we want them to work.
It's been pretty cool. A lot of very good learning experience. Kind of like wants me to join the medical field, but I don't like needles, so.
I think it's amazing. I mean, I've never actually seen anything about the robots like that.
This kind of makes me want to be a doctor and learn just how to do all this stuff, because it seems pretty interesting.
Just knowing that you could do all that, and yeah, I think I'll aim more for the nursing now.
Most of the robotic surgeons are laparoscopically trained, meaning doing big surgeries with small incisions.
As we progress in time, the technology is becoming more advanced, and if you take away the technology factor away from children, I feel that they'll be left behind in future industries, and so they won't have as much of an advantage as someone who has been learning to use such devices throughout their life.
We want to make sure that we always have a dedicated team, that there's somebody always there that understands the robot, how the instruments work, how to troubleshoot, and basically we get a feeling and understanding what the doctor wants or doesn't want.
We only need one incision to do surgery, what traditionally needs 4 incisions, for example, a gallbladder or a hysterectomy. So this effectively, in an incision this big, has 4 instruments and the gas port in there, so you don't need 4 incisions to have your gallbladder taken out anymore. You just need 1 incision in your belly button.
I just thank Medical Center for having us. It's been a great opportunity for my kids. I really appreciate it.